I think ADC is really exciting field today because we have the potential to replace chemotherapy and especially the associated toxicities for the patients. And I also think it's an interesting modality because we are talking here about targeted therapy, which means that the off-target toxicities are minimized. The cytotoxic payload is delivered really inside the tumor cell. We are also talking here about, I think, increasingly biomarker-driven development, which means that in the end the product will be prescribed and used in patients who respond best. Interesting also because you can innovate on the three components, so on the linker, on the payload and on the monoclonal antibody, which makes it possible to widen the therapeutic index, so maximizing efficacy whilst minimizing off-target toxicities, but also making new targets work, but also known targets work better.
ADCs, or antibody-drug conjugates, are exciting class. They're transforming the landscape of oncology therapeutics. They represent a major step in our daily battle against cancer, in order to bring a more efficient and safe treatment for our patients. The main challenges that we have with oncological drugs is to distinguishing between normal cells and malignant cells, and it have a big impact in quality of life of our patients. Added value of the ADCs in medical point of view is huge. They are acting like a precision-guided missiles and bring the cytotoxic drug directly to the malignant cells while sparing the normal cells. So today we have several ADCs which have been approved, and the others are under continuous development in order to bring more efficient and less toxic treatment for our patients.
At Debiopharm, we in-license, we generate data to add value to the assets, and then we out-license because we don't commercialize ourselves. For ADCs, this means we de-risk first-in-class and we differentiate best-in-class. First-in-class, for example, we've got an anti-CD37, which is entering the clinic this year in ML, and we've got a few other undisclosed targets in our early pipeline. We also explore bispecific ADCs and dual payload to address one of the key remaining challenges today, which is overcoming resistance, and in the end, further improve patient outcomes.
Daily mission at Debiopharm is to find more precise target in order to develop a new ADC for our patient in challenging type of cancers with high unmet medical need. One of the examples of this work is Debio 5062M, which is a CD37 targeted ADC, and we are developing this drug in acute myeloid leukemia. So at Debiopharm, our mission and ambition to bring this drug to the clinic for our patients who are suffering by this terrible disease. Of course, all of that we are doing with help of highly skilled key opinion leaders.